Welcome to Conversations with the College. We're so excited to have this opportunity to speak with OTs and other participants about psychotherapy and occupational therapy practice. My name is Sandra Carter. I'm the practice consultant here, and we also have Leslie Krempelik. She's the other practice consultant with the college. We also have Sonia Mistry, who will be assisting us this afternoon in moderating your questions, and also Eleanor Larney, the registrar, who will be joining us shortly. We are excited to let you know that we have over 400 participants joining on this webinar, and that we have individuals from various groups and sites. And we're just excited to be starting off our series of conversations with the college.
As Sandra said, there was so much interest in this webinar topic, and we appreciate that you have submitted your questions and put them forward to us. And there was definitely some commonalities in what people wanted to know when it comes to psychotherapy. So based on your questions, we're excited to have some conversations about psychotherapy in general, the controlled act of psychotherapy. We're going to be talking about training and supervision and the correct use of title. So whether you're an occupational therapist that's already practicing, or you are considering moving into the area or the practice of psychotherapy, we hope that this general information is going to be helpful to you in your practice. And if you have specific questions, we welcome those calls to our practice service here at the college. Just as we start off, some technical pieces. The default setting for the webinar is set so that there's an enlarged slide screen. So you can adjust this by pulling over the gray bar that divides the screen. And as a technical point, if you do have any difficulties with the audio or visual parts to this webinar, we ask you to contact info@codo.org. And of course, we invite you to submit any live questions that you may have into the chat box. So at this time, I want to check just to make sure that the chat feature is working in the webinar. So if some of you now can type in the city or the location that you're at, we'll just make sure that feature is working. Okay, that feature is working. And next, if you could just type the word yes, that to make sure that we can hear you okay, just to indicate that you can hear the volume's okay. Okay, we're getting thumbs up on that. So we are good to go. So to kick off this webinar, I'd like to turn things over to Eleanor Larney.
Hi everyone, my name is Eleanor Larney. I'm the Registrar of the College of Occupational Therapists of Ontario. The college is the regulatory authority for occupational therapists, which means that we set the expectations for safe, effective, and ethical practice for the profession. OTs are a very important part of the healthcare system, and many OTs work with individuals with mental health concerns. Occupational therapists are trained to work in mental health settings, and part of the work of the college is to ensure that OTs have a standard of practice that outlines the expectations for psychotherapy practice. Occupational therapists are permitted to perform the controlled act of psychotherapy. The controlled act occurs at the very far end of psychotherapy practice perspective when providing psychotherapy to an individual with a serious condition who has serious impacts from their condition. Because of this permission, OTs do not need to join the College of Psychotherapists in order to practice psychotherapy or do the controlled act. We do, however, collaborate with all the professions who are also permitted to perform the controlled act of psychotherapy to ensure that there's as much consistency as possible for safe, effective service delivery. Part of the legal process for the controlled act requires the college to develop a regulation that outlines more specifically the competencies at a very high level that are needed for OTs to perform it. The regulation supports the competence of OTs and provides an accountability mechanism to manage the risks inherent in the practice. We are engaged in discussions with the Ministry of Health, who has asked the college to develop a registry of OTs who perform the controlled act and make this public on our website. Transparency about OT practice is important to demonstrate the significant services they offer. A registry demonstrates accountability of OTs for their competency in psychotherapy. This registry will be developed in the coming year, and we will be reaching out to OTs practicing in this area for their input about what would be needed or useful on this registry. Please continue to visit our website for updates. And if you have questions, don't hesitate to contact the practice team or myself directly. Thanks.
Thanks, Eleanor. Today we wanted to be able to get to as many questions as possible. So let's start off the conversation with questions pertaining to understanding psychotherapy and the controlled act of psychotherapy. So the first one we wanted to know, when do the standards for psychotherapy apply?
The standards for psychotherapy apply to all psychotherapy practice. And it's not just limited to the controlled act of psychotherapy. The standards for psychotherapy outline the minimum expectations for all OTs practicing psychotherapy in Ontario. So on your screen, you may see this practice resource, When Do the Standards for Psychotherapy Apply? This is a great tool that OTs can use, and it goes through a number of statements to help OTs determine when the standards are applying for their practice. So, for example, when we're thinking about psychotherapy, we're thinking that it is an intentional and deliberate establishment of a therapeutic relationship with a client. And it's used to manage some of these modifying behaviors or adaptive patterns of behavior that OTs are so well equipped to address. So when we are thinking about psychotherapy, we know that OTs are completing a thorough assessment, that they're determining that the client is a candidate for psychotherapy. They are providing information to the client so that they can have informed consent or informed choice to engage in psychotherapy. They're also applying a theoretical psychotherapy approach, and they're using this therapeutic relationship to address the function or any behavioral issues that clients may have.
Perfect. Can you comment on practicing psychotherapy within the scope of occupational therapy practice?
Sure. This is a common question we get. As you know, the scope of OT practice is quite broad, but really OTs have a unique lens where they can use psychotherapy to address the adaptive behavior or augment function in the areas of self-care, productivity, and leisure. So really what this means is OTs are able to look at the client's purposeful occupation and identify what's useful and meaningful for them and help clients navigate their occupations in the various environments where they function.
Perfect. We have a clarifying question. Is psychotherapy just one-to-one, or can it be done in a group setting?
It can be done in both. It can be either done one-to-one or in a group setting. What really is important that clients understand and have the information necessary to make that informed choice and to provide that consent that they are engaging in psychotherapy.
Okay. If an OT is using a specific psychotherapeutic technique or skill, such as relaxation breathing or guided imagery in isolation, would that be considered to be practicing psychotherapy?
Great question, and the practice resource service fields a lot of these questions. And really, OTs know when they're performing psychotherapy. So if you're asking if in isolation, I would say no. That this in and of itself is a tool or a strategy or an intervention that an OT can use to address a specific issue. And the same goes for activities that are used in isolation, such as advocacy, health education, counseling, supportive listening, anything that you determine is an activity that you do not have that therapeutic relationship where your intention is to use a theoretical psychotherapy approach. It may not fall under the realm of psychotherapy provision of service.
Okay. Can you explain about the controlled act of psychotherapy?
Sure. What sets the controlled act of psychotherapy apart is the seriousness and the elevated risk that's associated with it. And for that reason, it's done by a qualified practitioner. So the Regulated Health Professions Act not only provides the authority for occupational therapists to be performing the controlled act of psychotherapy, but it also defines it, the definition in legislation. So we actually have the definition on the screen there for you. So let's take a look. So I want to draw your attention to some key terms in this definition. So it's the idea that you are treating a client using a psychotherapeutic technique, and you are engaged in a therapeutic relationship with the client, and the client has a serious disorder that has a serious impairment for them.
Perfect. And what about how could you distinguish if you were practicing the controlled act of psychotherapy?
Yeah, this is another question that we get commonly. So you don't have to be thinking about the controlled act of psychotherapy on a client-to-client basis, but overall, does your practice include the controlled act of psychotherapy? So we can look closer at these 5 key elements that was just introduced in the definition, and maybe go over some questions that OTs can ask themselves to help clarify. So the first component or element of the definition is the treating arrangement. So you are treating a client. This isn't kind of a helpful conversation that you may be providing to someone in a waiting room. So OTs need to ask themselves, have I entered into a formal therapeutic relationship with the client? And is this need for psychotherapy based on an assessed need or a diagnosis? The second element is that you're using a psychotherapeutic technique. So OTs can ask themselves, do I use one or more recognized psychotherapeutic modalities or interventions in my practice? So for example, within the cognitive behavioral therapies, an occupational therapist may use acceptance and commitment therapy. They may be using a blend of dialectical behavioral therapy and cognitive behavioral therapy as well in their modalities. And really, as autonomous practitioners, OTs are accountable. They're accountable for providing a rationale for the modality or interventions that they're choosing. And we expect that OTs know the effectiveness of different modalities, when they're warranted, any contraindications, or any risks or benefits that are associated with the treatment. The third component is that you have a therapeutic relationship with the client. And you can ask, am I intentionally developing a therapeutic relationship with the client? And are you purposefully using principles to build this therapeutic rapport with the client to bring about change? The last 2 important elements of the definition have to do with seriousness. So OTs need to use their knowledge, their skills, and their judgment to consider the seriousness of the disorder. For example, is there suicidal ideation, or is there an altered state of reality? Along with the serious disorder comes the impact. So the disorder, according to the definition, has to be considered that it seriously impairs a client's functioning. So OTs need to ask themselves, or can ask themselves, in which way has the disorder resulted in a serious impairment for the client? And maybe it's an inability to make reasonable decisions. It could be a difficulty in occupational performance. Maybe the client's not able to look after him or himself anymore. Maybe they can't function at work or school or in the relationships that they have. Just as a note, we have a document entitled Understanding When Psychotherapy is a Controlled Act, and we'll be sharing the link to that document after the webinar.
Perfect. Can you provide us with an example or a case scenario to demonstrate this?
Yeah, I'm glad you asked about that, because when we provide kind of clinical or case examples, it really helps to make this information more concrete. And we recognize that there is a complexity in providing mental health treatment. And we know that seriousness or severity can fluctuate at times, and the response of the clinician changes as well in terms of what their approach may be. So as a very simplistic example, I want to go through this case, this hypothetical case, to demonstrate when counseling and psychotherapy and the controlled act of psychotherapy might apply. So consider an occupational therapist who has an established psychotherapy practice within a university wellness center. A couple of months into the school term, the therapist sees a young man who's just started at the university and reports having difficulty adjusting to university life. So the occupational therapist may provide some counseling. They may do some supportive listening and some advocacy in terms of the residents and some information about general transition to university. So several months later, imagine that the client returns back for another session and reports that he's having a lot of trouble with his sleep and he's having increased worry and is feeling incredibly overwhelmed with the amount of coursework that he's planning to juggle, that he's trying to juggle, and his mood is really going up and down. And at this point, the occupational therapist may do some psychotherapy, some basic cognitive behavioral therapy for worry, maybe some sleep hygiene and other interventions as well. So as we progress, imagine that time goes by and the client misses several therapy sessions. And when he does return, he says things like his worry has increased to the point where he really isn't sleeping much at all. He's lost a lot of weight. His mood is very low. He's feeling helpless and hopeless and has some suicidal thoughts. He's avoiding most of the calls from his friends and family who are worried about him. He's using cannabis regularly, and rarely is he able to get to classes anymore. And of course, he's missed important deadlines. And at this point, he's at risk for dropping out. So based on the seriousness and the impact of this clinical situation, the OT offers and gets consent to do more intensive psychotherapy that would be considered within the controlled active psychotherapy.
Perfect. Thanks for that wonderful scenario. I see a few questions coming in about training and competence. Are there specific courses that the college would recommend?
Well, that's a great question. And OTs have sound knowledge in mental health. OTs must have the knowledge, skills, and judgment and the psychotherapy training to perform psychotherapy safely and effectively. OTs need to consider the context of their practice, so their clients, their populations, the type of service that's being delivered, and as well the practice setting. And in looking to formal training in psychotherapy, OTs need to ensure that they are complying with the standard. And there are 3 expectations for formal psychotherapy training. One is that it has to be instructional. There needs to be 2, there needs to be a theoretical component, and 3, there needs to be a practical component to the course, or that OTs have a combined experience, training and experience that the college would opine that is equivalent to the training outlined in the standard. So we rely on OTs really to evaluate the courses that they are interested in and to obtain that formal psychotherapy training and ensure that they are appropriate and meet the expectations outlined in the standard.
Okay. Are there resources that the college can direct OTs to consider psychotherapy courses or training?
Sure. We encourage that OTs seek out the professional associations, the Ontario Society of Occupational Therapists and the Canadian Association of Occupational Therapists have access to resources. The Canadian Association of Occupational Therapists offer workshops or training throughout the year. And the Ontario Society of Occupational Therapists has a useful resource, a compendium that outlines counseling and psychotherapy techniques for OTs in Ontario. And it looks at specific courses or psychotherapy approaches, competency development, and as well the supervision that's aligned along with the psychotherapy approach.
Okay, and I see some questions have come in about supervision. Can you speak to the expectations for supervision?
Sure. Supervision really is establishing a formalized agreement with a supervisor who will be overseeing the supervisee. And it is not the same relationship as a student and preceptor arrangement. It is really consulting on the psychotherapy component of their practice. So supervision can include, the supervision model. It can include information around what are the duties for within the psychotherapy agreement. And it really is to discuss the psychotherapy and also the therapeutic relationship with the client, and also promote progress with the psychotherapy growth of the OT. And the ultimate goal is to ensure that we are safeguarding the well-being of the client.
Okay. Does it have to be a one-to-one supervision? And who could be a supervisor?
It doesn't have to be a one-to-one. The college is not prescriptive about the supervision format. It can be one-to-one, it can be consultation as needed, or it can be in group format. What's important is that they are choosing a qualified psychotherapist practitioner and someone with 5 years experience and have the competencies to provide that psychotherapy supervision. And we know that OTs may obtain a supervisor that is not an OT. And one of the things to remember in that case is that if it is a supervisor from one of the other regulatory colleges, that they are accountable to their standards of practice. And we're already aware of some organizations have hired individuals to provide that supervision oversight for many clinicians. And so that supervisor would be accountable to their own regulatory body, or as outlined in our standards for practice, the application of standards, that would demonstrate why there was a variation from the actual standard.
Okay. What is involved in creating or making a supervision plan or agreement?
Well, it's a formalized agreement, and what can be outlined in that agreement is the responsibilities of the supervisor, the responsibilities of the supervisee. It may indicate the terms of termination. It may also outline the supervision model, and if there's any processes and procedures that are aligned with the supervisor and their regulatory college or the organization for which the supervision is being provided.
Does it differ depending on years of experience?
Well, the standards for supervision, and you see on your screen, we've identified psychotherapy supervision for OTs who may be starting their psychotherapy practice, and that's 3 years and under. And the expectation is that they engage in regular supervision or more structured supervision appropriate to their level of experience and their psychotherapy skills. And as well, OTs who have more than 3 years experience or have been in psychotherapy have been performing psychotherapy for a number of years. It's more of a self-reflective process and determining what type of psychotherapy supervision is appropriate. It might be more structured if it's a new area of psychotherapy that you're entering into, or it might be more of a mentorship and consultation format.
Okay. What if an OT, I think you just covered this one, wants to act as a supervisor?
Oh, that's our standards for supervision outline that very clearly, that OTs must have at least 5 years of psychotherapy supervision, that there are no limitations on their practice, that they have those competencies required to provide that supervision, the guidance, the direction, and must ensure that no harm comes to the client.
Okay. There are questions that we're receiving about the correct use of the title psychotherapist. Can you outline the use of title?
Sure. This is one of the areas where there's not much flexibility because the use of psychotherapist title is written in legislation, which is law. And so one of the things, if an OT wants to use psychotherapist title, that they must use protected title or identify themselves as a member of the College of Occupational Therapists of Ontario before they use the title psychotherapist. So On our screen, there are the examples of how you can use the title psychotherapist. For those OTs who do not want to use psychotherapist, as you know, we have the standards for use of title, and there is provision for OTs to use their name. So in this case, it might be Andrew James, OT Reg Aunt, and practicing in the area of psychotherapy.
Okay. What would you suggest if an OT wanted to expand their practice and move into practicing psychotherapy?
Yeah, we have a lot of people that are interested in moving into this area. So there's a couple of key things that people may want to do to move forward in that. So the first thing is really get to know the standards for psychotherapy. It outlines the minimum expectations that you are expected as an occupational therapist to be using. And if you're not sure where those standards are found, if you go to codo.org, and if you go to the Standards and Resources tab, and you'll see a list of our standards below, and the standards for psychotherapy are located there. It's available for everyone, so you don't have to be an occupational therapist to access these standards. The second thing that you might want to do is connect with your professional peer group or association. Link with the mental health community of practice, and just connect with other OTs. Find out what they're doing in the area that you're interested in moving in. And lastly, if you're ready to take that step, move forward and participate in an appropriate training program.
Perfect. So I see that we have some live questions that have come in. So I'm just going to pose them to you. So the first one is, if an OT reports to a non-clinical manager, what tools would the college have for that manager to evaluate if the OT is competent in psychotherapy practice?
Thanks for the question. We do have the standards for psychotherapy, and those outline the minimum expectations. So this is the standard that if you are performing psychotherapy, your practice will be evaluated against. We welcome any questions from employers to ensure that OTs are practicing competently and safely.
Okay, thanks. What about, does 3 years of experience mean 3 years of formally supervised experience, or could it be practice in any form?
So 3 years, as is outlined in the standards for psychotherapy, is 3 years of psychotherapy experience.
Perfect. Is there a minimum number of training hours that would be required to meet the standard?
We do not have a minimum number of hours related to psychotherapy practice. As you know, again, the scope of practice is so broad. There are OTs that are working full-time and part-time. And, we felt that OTs have an opportunity to self-reflect and understand and identify their gaps in knowledge. And they have to have that formal training in psychotherapy to be able to start practicing it.
Okay. Does a supervisor have to be an OT, or could it be someone registered, say, for example, with CRPO, the College of Registered Psychotherapists of Ontario?
Great question. And we did touch on it during the initial parts of this webinar. They do not have to be an OT. The expectation is that you are obtaining a psychotherapy supervisor that is competent to practice the psychotherapy approach that you are being supervised in. And then again, the reminder that if you are getting a supervisor that is not an occupational therapist or registered with our college, that they are accountable to the standards of their college, and there may be some expectations or requirements that need to be weaved into the supervision agreement.
Perfect. Can you speak to any type of documentation or suggest what type of documentation would be good during supervision sessions?
So what may, that would be already discussed up front. In terms of maintaining those supervisory notes, these do not go in the clinical record, but it would include, the questions that a supervisee may be posing to their supervisor, what the direction or guidance that was provided. The supervisor must maintain those supervisory notes for the duration of the supervision agreement, as well as the OT, who is the supervisee, must maintain their supervisory notes as well.
Yeah, we say it would capture the essence of the conversation
That's
that you
right.
had with that supervisor.
That's right.
Okay. How long does supervision need to last for independent, unsupervised practice?
For independent, unsupervised practice. You know, when you look at the literature, most psychotherapy approaches indicate that supervision is a lifelong process. And it really is that check-in to ensure that the client is getting the appropriate psychotherapy processes, the technique is appropriate. We often know that some of these situations, as Leslie described, are complex. There are different levels of risk, and you want to ensure that therapeutic relationship is appropriate for the client, and to manage those transference and counter-transference, or to make sure, even if you're using the appropriate use of self in therapy, you just want to make sure that the client is receiving psychotherapy that's appropriate.
And I guess I would also add that sometimes, the formal and structured and regular supervision may come to an end, but that doesn't mean that there's not an opportunity to have that consultation type of supervision for future.
Absolutely. Absolutely.
Okay. If an OT is registered with the college, but they're solely practicing psychotherapy, and also registered with CRPO, can they keep their OT registration?
Yes, they can. When you are registered with both colleges, you are accountable to both standards of practice. You have to be clear. The client should understand when you are performing occupational therapy or providing occupational therapy service. And as well, the other thing with that, when you're dually registered, apart from being accountable to all the standards of practice, you're accountable to the quality assurance obligations as well from both colleges. So, as we noted earlier, that OTs are not required to be registered with the College of Registered Psychotherapists of Ontario, because we do have access to that Controlled Act.
Mm-hmm. A question has come in: is it mandatory to use the title of psychotherapist if you're practicing psychotherapy?
No, it's not mandatory. But again, as we alluded to earlier in the webinar, that if you are using that psychotherapist title, that you must use protected title or identify yourself as a member of the college before you use psychotherapist. So on your screen, I believe that you're seeing the examples. If you do not want to use the title psychotherapist, you would, as outlined in our standards for use of title, your name, your OT designation, and you're practicing in the area of psychotherapy.
Okay. How do psychotherapy standards apply to older OT graduates, say 10 years plus? Does CODA require proof of experience in order to use title psychotherapist or to be a supervisor?
So you have to, one of the things we talk about is we really rely on an OT's clinical judgment and your self-declaration. We talked about what are the requirements for competency, and we talked about that if your experience and training are equivalent to the required formal training of instructional, practical, and having that theoretical component, that the college would, have the opinion that it does meet those expectations outlined in the standard.
Okay. We have a question. They're wondering about the clinical responsibility of the supervisor who is licensed.
Well, if you are taking on the supervisory role, there is that accountability. So you're accountable for the guidance and direction you're providing. And that's why there is an element of documentation with the supervisory notes, so that, as Leslie mentioned earlier, that's captured, the discussions.
Okay. And I just wanted to note we've had a few questions come in about liability or issues pertaining to legal type of advice. So if you just want to speak to those that, we're not able to provide legal advice.
Sure. In any OT practice, and when you are providing supervision, there is an element of accountability, there's obligation. But if you're looking for specific legal advice, that's not under the purview of the practice resource service. There are options for OTs to seek their own legal if it's around accountability. Some organizations have specific processes and procedures outlined around supervision. And you also can contact your professional liability carrier to seek further advice.
Okay. And a couple people have messaged asking about the session, if it's being recorded. Is there a way they can access it in the future?
Yes, we are recording the webinar, and it will be available afterwards. We will upload that to our site, and we'll also be making the resources that we're making reference to available afterwards.
Okay. Thank you. Do you need a supervisor if you've completed training and as part of your training you had a practical component?
Yes. I mean, the standards of practice outline that if you have 3 or more years of psychotherapy practice, that you're doing that self-reflective process and understanding that it may be more of a consultative or an as-needed basis. For the more complex situations or interactions with clients.
Yeah.
So again, these are minimum expectations.
I would say that OTs need to reflect on where the gaps in their practice may be, yep, and what they're doing competently, and where there's opportunities to get some further training.
Okay. If an OT completes one formal training course in psychotherapy and they feel that they're competent to practice, can they begin practice without supervision?
The standards of practice indicate if you are, and we've used that 3-year marker because we know that this is potentially OTs are performing psychotherapy or may have a component that is a controlled act of psychotherapy, and it is an opportunity for you to have someone discuss your psychotherapy intervention or approach with the client and provide that feedback. So it is one of the expectations that is outlined in the standards for practice.
Okay. An OT noted that they meet as part of a group with experienced OTs. They meet once a month and they provide peer supervision and support. How would you recommend that we document this?
Well, again, if it's a peer group or support, it has to be there needs to be that formalized agreement, right? And that who is providing that that feedback or the consultation, and who is going to be taking accountability. And that's why it can be done in a group format in discussion, but there should be someone who has been identified as the supervisor.
I would add to that if you're doing some peer supervision within a group format, that individually you want to be keeping records of any direction or feedback or recommendations that you received from the group, kind of the questions that you posed, any insights that you gained, any changes or recommendations that you're going to be implementing with the client.
Okay. You mentioned that if experience and training is equivalent to formal training, then CODA would determine if it meets expectations outlined in the standards. Does CODO evaluate experience and training to determine this? How would an OT ensure that their individual experience and training meets the standards?
Oh, that's a great question. You know, that our standards of practice are, again, minimum expectations. If an OT has, if there is a concern about an OT's practice, OTs will have to provide that information and demonstrate that they have that knowledge, skill, and judgment. And it may be providing that information about the training courses that one has taken, and being able to provide that rationale of how this training is meeting the standards of practice.
I would also just add to that there's so many modalities,
so
many different types of training, and the college isn't prescriptive. It's an expectation that as an occupational therapist, you're reflecting on your competencies. So for that reason, we're not prescriptive on what courses that you need to be taking.
Okay. What is an appropriate amount to pay your supervisor for their service of supervision?
So the college does not have specific guidelines in terms of costing, in terms of supervision. So that's something that has to be, when Sandra talked about that formal agreement with your supervisor, that's something that has to be discussed and negotiated between the parties that are involved. You may want to reach out to the association, may have some resources on that, but that's not something that's within that we could provide some advice on.
Yeah, we don't get involved in the provision of fees or the fees for any type of service. Yeah, as Leslie indicated, it really is an agreement, and it may be free. You know, there's the caveat, the continuum.
Okay, I see that we have time for one last question. When working with chronic pain patients, invariably there's some counseling provided. A therapeutic relationship is established as an OT and client. Can the OT say this is counseling and not psychotherapy?
So that's a good question. Do you mind repeating it so myself and the rest of the viewers can hear that?
Sure. So if working with chronic pain patients and you're providing some counseling, right? Can the OT say, call it counseling and not psychotherapy, or would the college come and call it psychotherapy?
So we do actually, as an appendix in our standards for psychotherapy, we have a table there that outlines the difference between counseling and psychotherapy, and we provide some examples around that. So as Sandra mentioned before, counseling may involve advocacy and health teaching, whereas psychotherapy would be using a psychotherapeutic modality, and it's to treat a client that has a psychological or mental health need.
Okay, so I think that's it for questions.
Okay, well, listen, I guess that's going to conclude our webinar for today. And what we really do, we just want to thank everybody for attending today. It's exciting to think about how significant and unique the role that occupational therapists can play in improving the mental health of Ontarians. And as we said before, we will be posting the webinar and some of the resources on our site after. This is the first of more conversations with the college, webinars to come. So we will be asking you to complete a survey, and we're happy to have any feedback that you can provide to us for future webinars. So it was a pleasure spending our lunch hour with you, and enjoy the rest of your day.
And we will have the questions in a practice resource that at a future date. Yeah.